So I am here to provide some clinical insight to the IT team. So I still practice family medicine 2 to 3 days a week, and then the days that I'm here, I work with the team on build and on requests that come in and really decisions that need made for changes to the system, but trying to put some clinical insights, some practical experience in there. CliniSync to me it's our link to everything outside of us as our system. So we're using that state HIE and being able to access, we have our own internal systems that let us look at our UH hospitals, but anything outside of that, which as much as we'd like to keep everything internal in the system, but it's inevitable that people are going to go across the street to our competitors, and we need to be able to know medically what's going on with them. So I think it's our link to the outside world in many ways. An example I can give is, a patient has been in the hospital and they're back to us. In the old world, we had to call medical records, have a stack of papers faxed, sort through all of those, and it was literally a stack of papers. 50 sheets sitting here in front of you. And now, if I know that patient's been in the hospital, I can go in and I can specifically look at, did they have an immunization while they're there? That's 2 clicks into there and into immunizations, and I can get to their discharge summary, I can get to any medications that were added. So all those pieces are there, and they're divided out. I can look for exactly what I need to look for instead of just sifting through that stack of paper. So efficiency is huge, and that information itself is essential. So in the old world, if you couldn't get a hold of medical records, or they couldn't get it faxed to you fast enough because that patient happened to call and an hour later was there, you had nothing. You were relying on their word of, well, yeah, they gave me that blue pill and I took it when I got home, and that's all you had. So it's just so much more specific data, and that's essential to good medical care. Again, I had a couple yesterday, really more with the HIE with CliniSync, where I had patients who had come to me and they'd been in an ER, and where I work, I'm in a corridor that has Cleveland Clinic, Akron Summa, and UH within a mile and a half. So, choose your own adventure. You kind of pick whatever system you want based on, a lot of times it's whatever ER had the shortest wait time. So a patient who happened to go to Summa, which is a different system, and came to me the next day for ER follow-up, and we had nothing. And we called the records department, couldn't get anything, and so instead I'm able to click that button, and there it was. There's the ER report, there's the antibiotic they were on, there's the description of, happened to be a wound that we were looking at, so I was able to at least get a description of that to compare to what the patient was sitting there with. Without that information, I'm flying blind in many ways. So that was extremely valuable. The other case is sometimes patients who've seen a specialist, and they may have seen them 6 months ago, and they assume we have the information. So, yeah, sure, I saw my renal doctor. Didn't they send you that note? And no, I don't remember what they did. And so I can able to dive into that information, and that's usually, again, that's a case that's outside of our system, because most of our notes are getting directed to us, our specialists within UH, but I can dive into the HIE and get that information and find out what they were told. Very often they assume we have it, and now we do, but we don't always know to go looking for it until they tell us. Sometimes it's older information that they may say, yeah, I think I had a CAT scan. You ask them, when? Well, a year ago, 2 years ago, I'm not sure, and I can go and see if that information's still valid and do they need another test. So I think it's reducing overuse of medical tests. So some things are good maybe for 6 months, some things are good for a year, but if they can't tell me when they had it and I don't have that information, I may have to repeat that same test, and that could be, say, a CAT scan. That's $1,500 or more dollars that may be wasted, plus exposure to the patient. So I think the staff benefits from that as well, though, because a lot of times it's not so. In my practice, we have a combination of people who are pretty independent, will go in and look for their own records, and folks who, if they need, know somebody's coming in for an ER follow-up, their answer is to either say to or message their MA, go find me the records. However you have to do it, go find it. So if the staff can get in there and knows how to access that, and we're trying to encourage them to learn that as well. We in our office have one MA who's kind of our lead MA, and she does a lot of the record searching, and she's very good at digging in and finding what's needed through the HIE or through the community record. And we're trying to train the rest of the staff to be just as efficient at that, because honestly, some docs, depending on how busy they are, don't have time to do it themselves, but it's something the staff can do as well.